10 things you must know about medications as you get older. It usually starts with trust. The doctor writes the prescription, you nod, take the little slip of paper or bottle of pills home, and follow the instructions. Morning and night. With the braceos, food or without. Maybe it's for your heart or your sleep or your blood sugar or something you barely understand but were told was important. And for the most part, you believe it's helping. Because that's how it's supposed to work. Medicine is supposed to help. But then something feels different. You're more tired than usual. You start forgetting names you've known for years. Your balance is off. Your stomach acts up. You feel a little off, a little foggy, but you figure it's just age, or stress, or bad luck, until it's not. Until you end up in the ER because you mixed the wrong pills. Until your blood pressure drops too low. Until someone else notices that you're not quite yourself anymore. And through it all, no one meant any harm. The doctors were doing their job. You were doing yours. But in the background, a quiet truth was unfolding. Your body was changing. And no one told you how that changes everything about how medications work. That's what this video is for. Not to scare you, not to shame you, but to give you something we all need more of: clarity. Because as you get older, the way you respond to medicine doesn't stay the same. Your liver processes things slower. Your kidneys don't clear things out as quickly. The way your brain, heart, and nerves react to certain drugs becomes more delicate. And when no one explains that, it's easy to end up hurt, even when you've done everything right. It doesn't mean you shouldn't take medication. In fact, many medications are life-saving. But it does mean you deserve to understand what's happening in your body. You deserve to ask questions, to know which combinations are dangerous, to speak up if something feels wrong, to be more than just a name on a chart, because you are not just aging. You are navigating a landscape that changes every year, and the more you know, the safer you'll be. So today, we're going to walk through 10 of the most important things you need to know about medications as you get older. These are the truths no one tells you until it's too late. But they can change everything, from how you take your pills, to how you talk to your doctor, to how long you stay strong, sharp, and independent. This is your health. Your brain, your body, and knowledge is your best medicine. Let's begin. One of the quietest truths about aging is that the inside of your body changes just as much as the outside, sometimes more. You might notice wrinkles, slower steps, or lower energy. But what's less visible is how your liver and kidneys, the organs responsible for breaking down and filtering medications, start to work more slowly and less efficiently. When you were 40, your liver might have metabolized a medication in a matter of hours. By the time you're 70 or 80, that same process can take much longer. Your kidneys, too, may filter blood more slowly, which means medications linger longer in your system. What used to be a normal dose now behaves like a higher dose, because your body holds on to it longer. The result? Stronger effects, more side effects, and a greater risk of toxicity, even if you're taking exactly what the label says. And it doesn't stop there. Your body composition also shifts with age. You might have more fat and less muscle, and that can change how certain medications are absorbed or stored. Some drugs are fat-soluble, which means they linger in body fat longer, releasing slowly over time. Others are water-soluble, and with less lean mass and less water in the body, they can become more concentrated. All of this adds up to one simple truth. As you age, your medications don't behave the way they used to. Even if your prescription hasn't changed, you have. And that means the same pill can now do very different things. That's why regular reviews with your doctor or pharmacist matter, not just to check your prescriptions, but to evaluate how your body is changing and whether your dosage or medication needs to change with it. Because your health isn't static, and your medication shouldn't be either. Understanding this isn't a weakness, it's wisdom. It's knowing that the more you respect your body's changes, the better you can care for the one thing you can't replace: your mind, your memory, your life. A little dizziness, a dry mouth, a strange dream, a twinge in the stomach. When you were younger, side effects from medication might have been a passing annoyance. But as you get older, those small reactions can become something much more serious. Dizziness isn't just dizziness anymore, it's a fall waiting to happen. Confusion isn't just forgetfulness, it's a risk to your independence. A drop in blood pressure, a spike in heart rate, a sleepy feeling in the middle of the day, all of these become more dangerous in older adults because your body doesn't bounce back the way it used to. It's not just about discomfort, it's about safety. And yet, so many people dismiss these symptoms or don't even realize they're related to the medications they're taking. You might say, "I'm just tired lately," or "I feel a little off," without connecting the dots. That's because many side effects disguise themselves as aging. They sneak into your daily life slowly, making you feel like you're just getting older, when in fact, your brain or body is reacting to a drug. Certain medications that were once considered safe in midlife, like sleep aids, antihistamines, or anxiety medications, can cause confusion, memory problems, or sedation in older adults. Blood pressure medications may work too well and cause fainting. Painkillers might build up in your system and affect your mood, your digestion, or your balance. The key is not to panic, but to pay attention. Keep a journal. Track how you feel each day. Note any changes in your thinking, your balance, your energy, your mood. If something shifts after starting a new medication, or even weeks or months later, bring it up to your doctor. Don't shrug it off. You have the right to know whether what you're feeling is a side effect and whether there's an alternative. Because many times there is, and the sooner it's caught, the better. You don't have to accept feeling worse just because you're taking medication. The goal isn't just to treat disease, it's to support the life you want to live. And that means being alert, involved, and unafraid to ask the question, could this be the medicine? Here's a word that should be more widely known: polypharmacy. It means taking multiple medications at the same time, often 5 or more. And while that might not sound unusual these days, especially for older adults managing several health conditions, the risks it brings are bigger than most people realize. Polypharmacy doesn't just mean a crowded pill organizer. It means a tangled web of drug interactions, overlapping side effects, and a body struggling to keep up. Let's say you're taking something for your heart, something for your joints, something for sleep, and a vitamin or two on top. Each one might be necessary. Each one might have been prescribed by a different doctor at a different time. But together, they can create a storm inside your body. One medication might amplify the effects of another. Two may cancel each other out. One might block your body from absorbing an essential nutrient. And suddenly you're experiencing symptoms no one can explain. The more medications you take, the more likely it is that something goes wrong. And it's not just prescriptions. Over-the-counter drugs, herbal supplements, and even vitamins can interact with your prescriptions in ways that increase your risk for confusion, bleeding, low blood pressure, kidney damage, or worse. The tragedy is that many older adults are hurt not by disease but by the very things meant to treat it. That's why regular medication reviews, also known as medication reconciliation, are so important. At least once a year, or anytime a new drug is added, you should sit down with a pharmacist or doctor and review every single thing you take: prescription, OTC, supplement, even topical creams or eye drops. Ask questions. Is this still necessary? Are there safer alternatives? Could I combine or reduce anything? Sometimes medications get prescribed as a band-aid for another medication's side effect. Sometimes you're still on something that made sense years ago, but doesn't anymore. You have the right to know what's going into your body and why. You have the right to simplify, to feel better, to protect your brain and your life from the risks of medication overload. Because more medicine doesn't always mean more healing. Sometimes it just means more danger, and you deserve better than that. It would be nice to believe that every doctor you see knows exactly what every other doctor has given you, that there's a seamless, magical system connecting your cardiologist with your urologist, your endocrinologist with your primary care provider, and even your eye doctor with your pharmacist. But the truth is, there isn't. Unless you or someone close to you brings a complete and updated list of medications to every appointment, your care is only as coordinated as the information you provide. And when that communication breaks down, the consequences can be serious. One doctor might prescribe a medication for your blood pressure. Another might prescribe something that also affects your heart rate without knowing you're already on the first. A third might give you something for anxiety or pain that interacts with both. They're not being careless. They're working with the information they have. But without a clear picture of everything you're taking, they could be prescribing in the dark. This is how people end up with two drugs that cancel each other out. Or worse, two that amplify side effects, cause internal bleeding, lead to dangerous drops in blood pressure, or impair memory. And when you suddenly start feeling dizzy or anxious or confused, no one knows which pill is to blame, because no one saw the whole story. That's why you are the most important link in your healthcare chain. Bring a full list of medications to every appointment, even if it seems repetitive. Include everything: prescriptions, over-the-counter meds, supplements, vitamins, herbal remedies. Write down the dose, how often you take it, and who prescribed it. If you've stopped taking something but still have the bottle, note that too. It all matters. Better yet, keep one list in your wallet or purse and update it regularly. If you use a smartphone, store it there too. If someone else helps you manage your meds, make sure they know how to explain everything clearly at appointments. You're not just helping your doctors, you're protecting yourself. Because the more informed everyone is, the less likely something gets missed, doubled, or dangerously combined. And that kind of clarity could quite literally save your life. The shelves at the pharmacy are lined with familiar names: aspirin, ibuprofen, cold medicine, sleep aids, allergy pills. They don't require a prescription, they're easy to buy, and they're marketed like candy. Just grab, go, and feel better. But here's the truth that few people say out loud: just because you can buy it without a prescription doesn't mean it's safe, especially as you get older. Many over-the-counter medications carry risks that increase with age. For example, NSAIDs, like ibuprofen and naproxen, can irritate your stomach lining, raise your blood pressure, worsen kidney function, and even increase your risk of bleeding, especially if you're already on blood thinners. Antihistamines like diphenhydramine, Benadryl, can cause drowsiness, confusion, dry mouth, or urinary retention. And over-the-counter sleep aids? Many of them are simply repackaged antihistamines that also affect your brain chemistry in ways that raise your risk of memory issues or falls. Then there's the issue of interactions. That seemingly innocent cold remedy might raise your heart rate or blood pressure. That heartburn relief might block the absorption of other essential medications. That herbal supplement might thin your blood without warning, just as you start a new prescription that does the same. None of these products come with someone explaining how they interact with your prescriptions. There's no pharmacist watching what you put in your basket. And many older adults assume, if it's sold over the counter, it must be mild. But your body is not the same at 70 as it was at 30. Your tolerance for risk is lower. Your margin for error is thinner, and your medications are more complex. So before you reach for that bottle at the drugstore, ask your doctor or pharmacist. Even one conversation can prevent a major problem. Keep a list of over-the-counter items you use regularly and share it during medical visits. And don't assume that natural means safe, or that common means harmless. Protecting your health means questioning everything that goes into your body, even the things sold in bright packages with smiling faces on the label. This is one of the most overlooked truths in healthcare, especially for older adults. You start feeling off. Maybe your hands shake more than usual. You've been unusually tired. You're a little forgetful or foggy, or your mood just isn't right. The assumption? Something's wrong with you. Something new. Maybe you're getting older, maybe you're developing something serious. But sometimes the problem isn't a new condition, it's a medication you've already been taking. Side effects don't always show up right away. They can sneak in gradually. They can mimic other problems. And when that happens, it becomes easy to confuse a drug reaction with a new diagnosis. That's how people end up taking medications to treat symptoms that were actually caused by another drug. You feel anxious, so you get a prescription for anxiety. But it turns out the stimulant in your allergy medication was triggering your nerves. You're constipated, so you start taking a laxative, but it was your calcium supplement slowing things down. You're depressed, so you get an antidepressant, but no one realized the blood pressure medication you're on can flatten your mood. It becomes a domino effect. One pill treats the side effect of another, and soon you're juggling 5 or 6 medications for symptoms that were never part of the original problem. This isn't uncommon. It's called a prescribing cascade, and it's one of the leading causes of overmedication in older adults. The solution? Be curious. If something changes in your body or your mind, anything from energy to sleep to mood to appetite, look first at your medications. Ask yourself, did I start anything new recently? Has my dosage changed? Could this symptom be connected to something I'm already taking? Then, talk to your doctor. Don't assume it's just getting older. Don't wait until it becomes unbearable. Your instincts are worth trusting, and your questions are worth asking. Remember, medications are meant to help you feel better. If they're making you feel worse, even subtly, speak up. You know your body better than anyone. You live in it every day, and when something feels off, it often is. You are not difficult for questioning your treatment. You are smart. You are involved, and that vigilance could spare you months or even years of unnecessary suffering. Sometimes the hardest part about taking medication is not starting. It's knowing when and how to stop. You begin a treatment, and maybe it helps for a while, maybe it doesn't, or maybe the side effects creep in, and you decide you've had enough. You think, I'm tired of feeling like this, I'll just stop, and you're not alone. Many older adults feeling overwhelmed, discouraged, or even betrayed by how a medication makes them feel, quietly decide to stop taking it. No call to the doctor, no tapering plan, just stop. But here's the warning that doesn't get said loudly enough. Stopping certain medications suddenly can be dangerous, even deadly. Some drugs create dependency, not because you're addicted, but because your body has adjusted to having them around. Antidepressants, blood pressure medications, anti-anxiety drugs, corticosteroids, and many heart medications fall into this category. When you stop them all at once, your system can go into shock. Your heart rate can surge. Your blood pressure can spike. Your mood can crash. You can feel dizzy, confused, sick, and not even understand why. Even worse, sometimes those withdrawal symptoms are mistaken for a new health issue. A rapid heart rate gets treated as a heart condition. Panic or confusion gets misdiagnosed as dementia. And all the while, the real issue was a sudden medication stop. It's not your fault. Often, no one explained the risks. But it's why this truth matters. Never stop a medication without a conversation. Even if you think it's not helping. Even if the side effects feel unbearable. Even if you just want a break. Tell your doctor what you're experiencing. Ask about tapering off slowly or switching to something gentler. There may be better options waiting, but only if you speak up. Stopping a medication isn't weakness. It can be the right move, but doing it safely? That's wisdom, that's courage, and it's how you take care of your body. Not just with medicine, but with intention. You probably know the basics. Take this one with food, that one on an empty stomach. But what most people don't realize is just how deeply your diet can affect how medications work. In fact, some of the most common foods and drinks can completely change how your medications are absorbed, how long they last, or whether they work at all. Take grapefruit, for example. It might seem like a healthy choice, but for many medications, especially for blood pressure, cholesterol, and anxiety, grapefruit can interfere with enzymes in your liver. That means the medication can stay in your body longer, reach higher levels than intended, and lead to toxicity. A single glass of juice can change everything. Or consider leafy greens like spinach and kale. These are packed with vitamin K, which is usually a good thing, unless you're on blood thinners like warfarin. In that case, too much vitamin K can reduce the drug's effectiveness, increasing your risk of clots. The problem isn't the food itself, it's how much and how often you eat it. Even calcium-rich foods, like milk or yogurt, can interfere with certain antibiotics or thyroid medications, preventing proper absorption. Caffeine can increase the effects of some stimulants or anxiety medications, making you jittery or unable to sleep. Alcohol, even in small amounts, can intensify side effects or interact dangerously with sedatives, antidepressants, and painkillers. Tiseo. Point isn't to make you fearful of food. The point is to pay attention. Ask your doctor or pharmacist, should I take this with meals? Are there any foods or drinks I should avoid? What about vitamins or supplements? Do they affect this medication? Keep a list of dietary restrictions if you take multiple medications. Even a simple schedule, when to eat, when to take each pill, can make a huge difference. Your body is an ecosystem. Food, drink, and medicine don't exist in isolation. They interact, and understanding those interactions helps you stay safe, alert, and in control. We tend to think of medication errors as something that happens to other people. But if you've ever forgotten whether you took your morning pill, accidentally skipped a dose, taken something twice, or confused which pill was which, you are not alone. In fact, it's one of the most common challenges older adults face, and it has nothing to do with intelligence or independence. It has everything to do with reality. As you age, medications become more numerous. Schedules get more complicated, vision may decline, hands may shake, memory may slip. And suddenly that little pill bottle becomes a source of quiet stress. Did I take this one already? Do I take this one with food? Wait, what's this little white one again? This confusion isn't just inconvenient, it's dangerous. Missed doses can make a condition spiral out of control. Taking too much of something can cause serious side effects or hospitalization. And yet, too many people feel ashamed to admit they're struggling to keep up. But here's the truth. This isn't a personal failure. It's a system problem. And systems can be fixed. Start with organization. Use a weekly pill organizer with compartments for morning, afternoon, and evening. Set phone alarms or reminders. Ask your pharmacist if your meds can be pre-sorted in blister packs. Keep a written schedule somewhere visible. Even color-coded stickers on your bottles can help. Don't be afraid to involve someone you trust. A family member, caregiver, or even a friend can help you review your meds weekly or check in once a day. Many people do this privately, quietly, without saying a word, but that isolation can put your health at risk. If your regimen feels too complex, talk to your doctor. Ask if any medications can be simplified, combined, or stopped. Sometimes a small change, like shifting a dose to a different time of day, can reduce side effects and improve clarity. Medication management is a skill, and like any skill, it improves with practice, tools, and support. You deserve a life where pills don't feel like pressure, where you're not second-guessing yourself, where safety and confidence go hand in hand. Because the goal isn't just to take your medicine, it's to take care of you, and you're not alone in that. There's a moment that happens far too often in exam rooms, especially for older adults. The doctor explains a treatment plan, a prescription is written, and even if something inside you hesitates, something doesn't sit right, you smile. Politely, nod and say, okay, you go home. You fill the prescription, you take the pills. And maybe they help, maybe they don't. But no one asked how you felt about it. And you didn't ask either. You see, somewhere along the way, many people, especially from older generations, were taught that it's disrespectful to question authority, that doctors know best, that saying no is being difficult, that disagreeing makes you sound stubborn or foolish. But here's the truth, plain and clear. You are allowed to ask questions. You are allowed to say no. This is your body, your life, your future. And any medication you take should come with understanding, agreement, and consent, not pressure, confusion, or silence. Asking questions doesn't make you a problem. It makes you informed. It opens doors. It uncovers better options. Sometimes the doctor is rushed or forgets to explain. Sometimes they assume you understand everything already. Sometimes they've prescribed out of habit, not out of custom care. That's not a judgment, it's reality. And it's why your voice matters more than ever. If you're unsure, ask. What is this medication for? What side effects should I expect? Are there non-drug alternatives? What happens if I decide not to take it? Is this something I'll need forever? You may be surprised how open your doctor is when you begin that dialogue. And if the answer doesn't feel right, or if you feel rushed, you are allowed to pause. You are allowed to say, "I'd like to think about it," or "I'd prefer a second opinion," or even simply, "I'm not comfortable with this." That's not rebellion. That's self-respect. You've earned the right to be part of the decision-making process, not just as a patient, but as a partner. Because the best medical decisions are not made to you, they're made with you. You've lived long enough to know that your gut matters. That sometimes the most powerful word you can say in the face of pressure is a gentle but firm "not yet," or even "no." That's not fear. That's courage. That's wisdom. That's taking your health into your own hands, where it belongs. We live in a world where medications are everywhere. For every symptom, there's a pill. For every diagnosis, a prescription. And while that means more hope, more healing, and more longevity, it also means more complexity, more risk, more responsibility, placed on the person swallowing that little capsule every morning. But you are not powerless in this. In fact, you hold more power than you realize. Today, we walked through 10 essential truths about medications as you get older, not to overwhelm you, but to equip you. Because aging doesn't mean giving up control. It means learning to navigate differently. It means learning how your body changes, how your risks change, how your choices change. You've learned that your body doesn't process medications the way it used to. You've seen how side effects become louder and more dangerous with age. You've understood the risks of polypharmacy, the gaps between doctors, the illusion of safety and over-the-counter drugs. You've learned to question symptoms that sneak in quietly, to taper medications instead of cutting them cold, to pay attention to what you eat and drink, and to organize your routine with care. And most importantly, you've been reminded that your voice is not just welcome, it's vital. This isn't about fear, it's about freedom. The freedom to live clearly, to feel safe, to stay sharp, to trust yourself, to protect the life you've worked so hard to build. No one knows your body like you do. No one walks in your shoes. No one else takes the pills, feels the effects, or lives with the outcomes. That makes you not just the patient, but the captain of your care. So as you move forward, take these truths with you. Keep them close. Share them with someone you love. Write them down if you need to. Print your medication list. Ask better questions. Say yes when it feels right, and no when it doesn't. Because your health is not just about what goes into your body, it's about what you know, what you say, what you choose. You deserve care that honors your years, respects your wisdom, and protects your mind and body. Not just today, but for all the days still to come. You are still learning, still growing, still leading. And with the right knowledge, you're not just aging, you're aging powerfully.